and we will send that out as a follow-up in regards to our next event that we have every Wednesday, Lunch with AKUA. So you'll be receiving that, and also a list of, please put in the chat who you are, what you want to say about yourself, your background, your practice, contact information, so we can make sure we share that with everybody as well. I will go around and let everybody introduce themselves as we want to know who I think I know most of the individuals on here, which is great to see. But we also want to make sure that we know each other, as we have so many resources to offer, and sometimes it's right around the corner from each other and we don't know it. So, so thank you for that. Let's go ahead and kick off, and I'll let each of you introduce. I'll start with Craig, if you wouldn't mind introducing yourself and a little bit about yourself.
Sure. Craig Wetter. I'm a clinical forensic psychologist, but I'm also a practicing clinician. I do a lot of trauma work with first responders, and previously worked with military personnel. I'm licensed in California as a psychologist, as well as Nevada, and in a forensic hospital in Nevada, and then also a professor in the doctoral program at California North State University, and assistant clinical professor at UNR School of Medicine.
Phenomenal. Thank you, Craig. Thank you for what you do. Appreciate you joining. Marion.
Sorry, I was muted because there was too much noise going on in our home.
Okay.
I'm a psychologist. I've done a huge variety of different things. And right now I'm a counselor, mental health counselor at Miramar Community College, and working with students remotely using Zoom, which is not my favorite modality, but it's better than just a voice.
I agree. I think we all want to get back, well, at least I do, I want to get back to what normal was and get back in front of individuals. So thank you for joining, Marion, and thank you for what you do. Jake.
Good afternoon. Thanks for having me. My name is Jake Leclerc, and I'm a person in long-term recovery. I also work as a recovery coach, helping people recover from life's hopeless state, working in my private practice called Emerge Resilient, and we do our work with horses. Thank you.
Thank you, Jake. Nice to meet you. Emily and Hannah Kate.
Hi, I'm Emily. I am the Director of Business Development at Montecatini. We are a residential PHP and IOP eating disorder treatment center in Carlsbad, California. And we treat females ages 16 and up, and take most major insurances. This is Hannah Kate.
I'm Hannah Kate. I am part of the BG team, as well as I'm the alumni coordinator. So I run groups and I stay connected to those ladies. And we would love to chat with anyone who has any questions.
Great to see you both, and we love the work you do. So thank you both.
Thank you guys.
Justice.
Hey, Michael. Thanks for having me. Good to see everyone. So I'm Justice Olson. I've been in the field for about 5 or 6 years in various roles, such as business development, one-on-one counselor, group counselor, things like that. And I'd say I'm just kind of like a lifelong learner, could always learn more about different resources, cool modalities, and I've been very interested in brain spotting. I've heard fantastic things. So yeah, I just really am here to learn more. Good to see you guys.
Good to see you, Justice. Melissa. You're muted. Hold on one second. You're muted. We'll submit you.
I knew that.
There you go.
Yeah, I just put my contact information in the chat. I work with trauma and addictions of all sorts, including eating disorders, and troubled teens and desperate parents, and bipolar as well. For the time being, I'm doing only video counseling, and it's working basically okay. Not as good as being in the room with somebody, but I can keep working and I can keep helping people, so that's good. What else do I need to say? Anybody have any questions?
Glad to have you, Melissa. Thank you for what you do. And I'm going to continue, I'm not skipping over you. Tara, I'm going to let you go ahead. Is it Tara or Tara?
Yeah, it's Tara like Sarah. You got it right. So I am the addiction team lead at the Sacramento VA at Mather. So I've been there for almost 12 years. I've also worked with people who've used sexual violence. I supervised a mobile crisis team in the past. So I do a lot with addictions and trauma, clinical psychologist.
Thank you, Tara. Good to see you.
Good to see you.
Pamela Taylor.
Hi there, everyone. My name is Pamela Taylor Gomez. I'm with Mission Hospital Laguna Beach and their Mental Health and Wellness Clinical Institute. I'm the Intake and Outreach Coordinator. We specialize in acute medical detox. So we take those wonderful Blue Shield policies, and we also have primary chemical dependency, PHP and IOP, and then primary mental health, PHP and IOP. Right now we are offering both in-person and telehealth options are available, and we're in network with just about everybody, including Medicare, TRICARE, and Blue Shield. So thank you so much for having me, Michael.
No, thank you, and good to see you as always. Daniel.
Thanks for having me, Michael. Good to see you. Sorry, I'm driving, but super interested in brain spotting, so I figured I would hop on. I do the business development for Delphi Behavioral Health Group. We're a national network of substance abuse and mental health treatment facilities. I'm down in San Diego, born and raised down here, and I'm trying to make an impact in the local community. So thank you.
Thank you, Daniel. Be safe. No, Kelly he's here, but he's running a little late, so I won't call on him. And now I want to know how to pronounce your last name. That's what I need to know. I need to know how to pronounce it all. So
I'm curious, how would you have pronounced it before I tell you?
I'm from Indiana, so I'm going to pronounce it Daya.
That'll work. It's Myers, the first name. I go by Daya as the second name, but oddly enough, my brother goes by Daya, which is a little weird. Even though we're related, same last name, we pronounce it differently. As always, Michael, Angelina, you guys, thank you for having me. As I reference this on every call, this allows me the opportunity to stay connected. Kind of like Michael, you were mentioning, man, seeing people and the face-to-face interaction and facial expressions help me stay connected to the community. And as Justice mentioned, I too am a lifelong learner, and I just appreciate kind of learning about everything. The nuts and bolts of it is I work for Quest Diagnostics. I'm in the toxicology division, working with a lot of substance use disorder treatment centers. And again, man, I just love being connected to the community, and I'm grateful that you guys allowed me to join this and feel connected. So I appreciate it.
Thank you so much. Appreciate you joining, as always. And so I'm going to kick it to Angelina here in a moment, and let her introduce herself. I think many of you know her, some might not, and let her do a brief overview of our Sacramento location. And then, of course, we'll introduce Sean Bezdek, our program director, and he will introduce our guest speaker for today. So Angelina, would you go ahead?
Yeah, hi everybody. Welcome to our weekly lunch Zoom session. For those of you that don't know me, my name is Angelina, and I am the outreach specialist for AKUA, but I really kind of work and represent the Northern California territory. So I'm really excited that you guys are here. The program that we're going to be highlighting today is actually very near and dear to my heart. So this program specifically is our 16 male bed residential facility for any males that are struggling with dual diagnosis, but primarily substance use. A little bit about the program. The staff there is absolutely amazing, which you guys will probably kind of get a warm feel from when you hear our director and our therapist speak. One thing that our clients, when they leave our care at that facility, one thing that they really just speak so highly of is just like the family environment that we have. Today, Jamie is actually going to be presenting, and love Jamie to pieces. I've known Jamie for probably about 2 years now. So she functions in the role of one of our primary therapists there, and I'm not going to steal the spotlight from her, but just a little bit of things that I've gotten to learn about her. So she is known for having candy in her office, and it never lasts a day. Like, I don't know how she affords to keep the candy in her office, because the clients come in and take it, and the staff comes in and takes it. And there's become a point where she's had to put a lock on the candy because we're just candy fanatics at AKUA. So one time I had asked her, I was like, doesn't it get really expensive, providing all this candy for us? And she had said yes, but the reason why she chooses to keep candy in her office is because it makes clients feel more comfortable and inclined to step in. And it's nice because when you walk into her office, the candy is right next to her door. So it's really at arm's reach. And it's so funny because I think it truly makes the clients more comfortable about coming in and then being able to start conversations. So I don't want to say that's one of my favorite things about Jamie, but I just thought that was something really special because I feel like you can really tell when someone cares about their job, when they really make their space their own. So if you see her office, she has a bunch of different knickknacks that really just is who she is. She has a bunch of little, what are they called? Like fidget spinners, Play-Doh, things like that. Clients will come in and just touch and, start talking. And then another thing about Jamie too is that I think she's completed her second phase of Brainspotting. At this facility, we actually have a first responder track. So I know Dr. Nevins is on the call and she'll send a lot of veterans to us. So we recognize that, the underlying issue of addiction is commonly trauma. And especially when we have those first responders, they're not just coming to us with, trauma from being overseas or trauma from the job, but they're also coming with a lot of childhood trauma, a lot of trauma that is unresolved and has not been processed. And unfortunately, we only get to keep these individuals in our care for a certain amount of time. So yes, we can offer psychotherapy, but that talk therapy can only get us so far, which makes me really grateful to have Brainspotting, which is an evidence-based trauma therapy that can really just at a more accelerated speed, really get to the root of trauma. I've had a lot of first responders in my care. I've had a lot of people from the general population in my care that really come with that extensive trauma piece. One of my veterans that I love talking about came to us and was a combat Marine, fought in our war with Iraq, had like 4 combat tours. So you can imagine the extensive trauma he had. He had been to like 20 treatment centers, did all the therapy in the world. And it wasn't until he came to AKUA and did the Brainspotting that he was like, whoa, like this is the first time that I've tapped into some traumas that I've never been able to tap into, with other forms of therapies that had been offered to him in the past. So I've seen firsthand just the healing that takes place from Brainspotting. And I'm really excited for you guys to be here, whether you guys are already trained in Brainspotting, and are here to really collaborate, or if you guys are here to really just learn about Brainspotting. I'm just really excited for all that Jamie has to share. So with that, I'll go ahead and pass it over to Sean.
Thank you. So my name is Sean Bezdek. I'm a marriage and family therapist. Been with AKUA 2 months now, yay. And I've been working in the mental health field for a long time. And I think one of the things that really drew me to AKUA was kind of the family atmosphere that we have here, in the teamwork and the real dedication to patient care. From the top up, everybody is really dedicated to making sure that individuals get that quality care. In coming on board, honestly, I didn't know much about Brainspotting. So I've been really fortunate that Jamie has kind of mentored me in being able to understand more about Brainspotting and about the effects and really how it's really impacted our clientele. So Jamie, I want to pass it off to you to kind of kick it off and talk a little bit more about Brainspotting and how effective it is for the clients that we serve.
And I'll jump in real quick, Jamie, before you start. I just want to make sure, we'll leave a few minutes at the end for questions, but if you have something that's pressing, please either put it in the chat or raise your hand. We're friends. So let's make sure that we're getting everything you guys need. I know Jamie probably could talk for 2 or 3 hours on this. So, I want to make sure that you guys get what you need specifically out of this, or for something specific that you would like to hear. So now, Jamie, I'll turn it over to you to kind of talk about this great topic of Brainspotting.
Awesome. Thank you guys, everyone, for coming and, taking the time out of your day. Like it was said before, your time is so valuable, and to be this passionate, to take some time, I really just appreciate it. First of all, just to let you know, I've been practicing brain spotting now for about 1.5 years. I don't consider myself an expert, but one thing I do know is that I have seen so much positive results. I truly believe in it. And I hope that you can just get a feel of my passion and just learn something from it. And like Michael said, you can ask any questions. It's totally open forum. So I guess I'll begin. I actually took brain spotting classes or the training from Lisa Larson, and she is one of the therapists, one of the head therapists over the Pacific Trauma Center that's in Folsom here in Sacramento. And I did the beginning brain spotting. And after that, you, because it's a very intensive 3-day process, and you're going through demonstrations, and you're also practicing. Brain spotting is also happening on you, and you're doing it on others, and you're learning the techniques. And so you're let go and free to fly, as you would say, in practice. And then I instantly came back to work super excited, because one of the things that I noticed with the brain spotting is how it can help dig into some deep trauma without having to retell the story and re-traumatize our clients. And that's super important for me, their safety. So one of the things, or I want to give you guys a little idea of what brain spotting is good for. It's good for trauma, PTSD, depression, anxiety, sleep issues, any type of physical symptoms that you may be dealing with, and then also anything, and I like to describe it to my clients, anything you feel stuck in, where you just kind of like, emotion or an event, you just kind of feel like it controls you, like you're just stuck in that, where you so I like to think that it can help you get unstuck. So any reaction you may have to something, so if you're triggered and all of a sudden you notice that you always have this reaction of fear, we can work on that with brain spotting. So it doesn't have to be real complex trauma, it can just be anything. And basically, brain spotting was founded by David Grant. He was a therapist, and he was practicing EMDR, and he was working with, I believe, correct me if I'm wrong, Sean, I believe it was an ice skating athlete. And she was just really having some trouble hitting some bumps, or some of her, it was like the triple axel or something like that. And what he found is while he was in the midst of doing the EMDR, that she had stopped and just in this gaze that she had started really just processing and going deep. And he, being a good therapist, was following the client and just decided, okay, let's go with it. And so he just let her go and let her process. And then afterwards, she had said she felt this sense of relief and was able to hit her triple axel and not have a problem with it. She was, what that point for her brought up was some worthlessness and some fear, and she was able to process those feelings. So then he decided, this is something really interesting. I want to work on this a little bit more. I want to do a little bit more experiments and see if this happens, if there's something that's going on with this. And he ended up, that's how he discovered brain spotting. It was completely by accident almost, right? So what brain spotting, what he has found is that it's not, it goes deeper than talk therapy. Talk therapy, we really just kind of go into the frontal lobe, you process those feelings, and maybe even kind of go into the more emotional side in your brain. But what is found with brain spotting is that it is more where you have access to your subcortical part of your brain, where you store your emotions. And so he found that the eye position is important because we have optic nerves, and it actually connects to the subcortical part of your brain. And depending on where your eye position is, it gets access to those emotions. And also you have some sensory responses as well. And Brainspotting's really pretty, it's not verbal as much, but it's much more emotional and much more somatic. So it's really involved. The person is able to process it, and it's encouraged, and then they will be able to move through those feelings instead of staying stuck and just talking about it. And I like to use the example with my clients of when you are in the mud with your boots and you feel like you're trudging through that mud. It's difficult, but through Brainspotting, we help you process through it instead of going around it or instead of staying stuck and sinking in it. Brainspotting is very experiential rather than a theoretical or logical base. And one of the things that's really important is the therapist. It requires a lot of attunement, and it requires a lot of emotional support. So with Brainspotting, like I said, you don't have to relive and talk about the event if that person doesn't want to. And this is why I love it for my vets and my first responders and people that are dealing with some deep trauma. They can just come in and say, hey, I want to deal with the issue of depression. And I'm saying, okay, give me 3 words that can help you to activate that feeling of depression in you. And they might say something like, my father, family conflict, and fear. And then with that, I can help raise that activation and do the process of Brainspotting. And then it's more of an emotional type of thing where they are working through it and processing it. And then if they choose to talk during that, they can talk. If they choose to remain silent, I had one guy the whole hour and a half, he decided that I was the brain spot and was looking at me the whole time and processed completely silent. And then when he was done, he was like, oh my gosh, and then told me, kind of what was going on for him. The therapeutic technique, one thing that I really like about this technique is it's led by our clients. It's not led by the therapist. So I always tell my clients when we're getting ready to brain spot, I'm like, first of all, you are in charge. You tell me, if you don't want to do this anymore, or if you're getting overwhelmed, because I have tools to help with any type of feeling of overwhelmness. And then also, this is not about pleasing me. This is about you. And we also, the other thing is that it's non-judgmental. So if you're feeling a certain feeling, it's really important to encourage the client to just feel it. They might say, I'm feeling anger right now. I'm feeling anger towards my mom because she was with my dad and she wouldn't leave him. And then they might say, but it's, she really tried and she didn't know what she was doing, and they might try to minimize the feeling and go through it. And as the therapist, being in tune and really seeing what's going on there, I can take that moment and encourage the client to say, let's not judge this feeling of being angry right now. Let's just feel that feeling of being angry, and let's process it. And there's no judgment here. And it's not saying you love your mom any less. And then encouraging them to go back in and process that. And so they're able to kind of get unstuck. One of the things also that I find quite interesting is with this, there are a lot of somatic symptoms that might show up. And so I will tell the client, whatever happens with your body, also don't judge that. Some of them will sweat a lot. There will be some shaking. They might even feel some pain in different places. I just had an experience with somebody that was kind of bringing up some memories of some child abuse and had said afterwards, oh my gosh, I really felt some pain in my ribs. And when we explored that, it was because of he was reliving a little bit of what had happened before. It wasn't as bad, where he was getting re-traumatized again, but he was just feeling the pain on his ribs because he was getting hit there. He was also talking about the room being really hot and he was sweating. There might be feelings of, pressure in your chest, or you might feel like really short of breath. And so I just encourage the client, don't judge it, just feel it. Let your body go ahead and process that and just feel it. And your mind, your brain it knows exactly what it needs to do. It's been working with you your whole life. And so it knows what it needs to do to heal. And we just allow and trust that the client and that their brain is going to work through and let them process these feelings. Another thing that I really like about this is that a lot of our clients with have a lot of disassociation, and they have been using that as a coping skill, and they come in and they find it really hard to get in touch with their feelings. They don't know what they're feeling. And so with the brain spotting, it helps them to be able to experience the somatic symptoms, and then they're able to process those symptoms and still get relief. And it also helps them to have a safe way to reconnect with their feelings. You're taught in the second stage of brain spotting some really good resourcing. So when you have people who have pretty intense complex trauma, you don't have to just depend on the one way. There's like lots of different ways to be able to kind of filter or decrease the emotion in the processing, if you will. We have goggles that do with one eye. And there's different techniques to be able to kind of help them. Like, it's really strange, but if you hold the pointer a little bit further away, it can help to reduce the amount of emotion that they're feeling at that time. Or if you hold it closer, you just have to experiment with the client. And so there's different ways to be able to help them to access their feelings and not get overloaded and want to disassociate or run. What else? So basically, I don't know if you guys know, but the logistics of brain spotting is what you do is you give the client some bilateral music and they listen to it in their headphones, and it needs to be just loud enough for them to be able to hear the music, but also to hear you. And then you position yourself, your body position, in a chair across from them and close enough to where they feel safe, but you need to ask permission. Is this too close? You want me closer? You want me farther away? And then there's a pointer. And when you get them what I call activated, which I mean the increase of feelings. So if they want to work on the issue of depression, and I will say the words, and I will give them the bilateral music, which helps to activate them. And then I'll ask them on a level of 0 to 10, where are you right now? And I want to get them probably like about a 5 or 6 or more. If they're under that, I'm going to ask them for maybe some more triggering words that might help increase that feeling. And then what we do is we find a spot. We put the pointer in front of them and we go from different sides. And I'll say, when you're looking at the pointer, do you feel an increase, a decrease, or the same at this point? And then they'll say, I feel decreased. And they'll say, and I'll move the pointer over and I'll say increase, decrease. And while I'm moving the pointer though, I want to rewind real fast. While I'm moving the pointer, one of the things in the training is they teach you to look for somatic symptoms of the client. So you'll see like lots of blinking, or they might swallow like that, or they might even cough or sneeze. Those are activation points. Those are really important. So sometimes when a client can't find a spot, you can find the spot for them. There's different terminology for it, but basically you can say, you know, you see a lot of blinking and all of a sudden you're like, tell me what's going on right here. And then they'll be like, I felt really hot. And I'm like, okay, let's go ahead and process that feeling of being really hot. And then they'll sit there and think about it for a minute and they'll process it. And they're like, I'm feeling angry right now. Okay, let's go ahead and process anger. I'm thinking about the time that, you know, my dad locked me out of the house and wouldn't let me in and was calling me names. So, you know, you found that spot for them. So you don't have to always depend on the client, especially if they're really disassociated from what's going on, or if they tend to minimize their symptoms. They won't feel it as heightened as maybe you will see. So you find their spot, and then you go through and you just say, let's go ahead, let's work through it. And if to keep them on track, if you think that they're kind of like not really engaged, you can just ask them, tell me what's going on inside of you right now. And usually they'll say something like, my chest is really tight and I'm starting to feel anxious. And I'll go, okay, let's process that anxiousness and see where it takes you. And then allowing them to be in that anxiousness, however long it may take them. It's not timed. They just process it, and you'll start to see and notice through their body symptoms. Some of them, like I said, will be verbal, and they might tell you what's going on inside of their head, but you don't need that. And a lot of the processing, when we're in therapy, I'm not talking. I'm talking very minimally. What I'm doing is I'm being there, I'm being very attuned, I'm paying attention to the responses and the reactions from the client. If I notice that they're skipping over something that may have been really important, I'll invite them to come back and just feel it, and then let them go ahead and move forward. If I feel like maybe they're disassociating or they might be off track and distracted, and I'll ask them, what's going on inside of you? If they say, I'm not really feeling engaged, I'm not really feeling activated right now, I'll be like, okay, let's go find another spot and we'll work through the spots. And sometimes also, which is kind of cool because it really is client-led, when they are listening to that bilateral music and they're starting to feel, get into their emotions and feel the issue, you'll notice all of a sudden they'll just start processing and start talking about what's going on in them, and they're doing what's called a gaze spot. They might be focusing right down on the right side of the floor. They might be focusing somewhere in the wall. You don't even need to worry about going and getting the pointer and moving them because they've already found their spot. And so you can let them work from that spot. And then the end of it, when they have processed their feelings and processed and went through whatever it is, we say whatever fires together wires together. So they might say, I want to start with the issue of depression, and then they end up being over at being super angry and having a lot of fear because they were thinking about when they were in 5th grade and their mom and dad all of a sudden decided that they were getting a divorce. And then, you know, it's kind of like getting to the root of that depression for them and walking through it. And then my clients, what ends up usually happening is that you'll see this like, and I'll say, tell me what's going on in you right now. And they'll say, I don't know. I feel like a weight has been lifted off my shoulders, or all of a sudden the tightness that was in my chest is gone and it just feels better. Or they'll say, well, actually what I'm thinking about is that happened so long ago and the relationship with my parents is better now and it actually worked out
I think she might have froze, Sean.
Oh. Hold on, I'm gonna go let her know.
Yeah, they're in the same building, so give us 1 second. So right when it was getting good too. Hold on 1 second. Technology.
Hey, Michael, this has happened. And she had mentioned the use of a pointer. Is that an actual physical pointer, a laser pointer? Did I miss that?
It's like a I don't know how to do it, but it's like a stick that extends. The feel of it is metal. Some people joke and call it like a Harry Potter stick. But essentially it's just kind of like a stick, like a pointer stick that you would use. It's no laser or anything like that. And basically once they've already been bilaterally stimulated, like with the music, they'll hold the pointer, and the client, when I've sat in on it one time, the therapist will slowly move it, and it'll get to a point where the client like will stop and like, okay, stop right there. The client that I had sat with in particular got to the point where he could no longer look any further. And that's what happened, is that he's locating that brain spot that she's talking about. And she's back.
And now she's back.
I'm sorry, you guys. I don't know what happened.
Okay, you froze. You were fine. Go ahead.
Where did you guys stop hearing me at? Do you remember?
It was only for a second. So I think where you were at, we were pretty good.
Okay. So I was basically saying they kind of naturally wind down themselves, and then they'll tell you, I think I'm done. And I'm like, okay. And I'll check in with them and I'll say, okay, so on a scale of 0 to 10, when you think about that first issue that we talked about, the depression, and you think about your father and your family and the sadness and fear, where are you? And sometimes they might say like, I'm about like a 2. Oh, okay. And then you can choose then, depending on the time that you have left, and how the client feels, you can say, well, how about this? We call it squeezing the lemon. How about this? How about we just focus on this real fast, focus on the brain spot, and let's see if we can just get that last little bit out. And some of them will say, yeah, that sounds good. Some will say, you know what, I'm done, I'm tired. Okay, if you're willing to quit, that's totally fine if you want to end, and because it's led by them. Now, if they're wanting to stop because the emotions are too intense and they're like at an 8, or something like that, that's when I like to bring in my resources to help calm them, because I don't want to leave them what we call open with all of that trauma and those really intense feelings. And so I'll try to do some things that we were taught in the group or in our training to help calm them and bring them down. I'll even encourage them by giving them, like I said, I have resources, like I have the goggles, or I can move the pointer further away. I could do it from what's called a less activated spot. Remember how when I was introducing, I'll say, is that higher, lower? I'll say, well, would you like to try it at the lower spot? And we can see. So, we have different options. We don't have to overwhelm them with all those feelings. And then at the end, usually like they're kind of what you call open a little bit, like they're still processing for about a day or 2. They might be thinking about some stuff a little bit in the background. I usually tell my guys, you know what, just be gentle to yourself right now. Just give yourself some time to rest. It can be physically exhausting. For myself personally, when I went through brain spotting, I was hungry and I was super tired, and I slept like a baby that night. I mean, I was out. So usually my guys tell me, the ones who have nightmares, they love to brain spot because they don't have nightmares that night. And so it's kind of a nice relief for them. And then they will usually, after a couple days, notice that all of a sudden there's not that thing going on. They're not really thinking about it. But what they do notice is that the feelings, the emotional reaction that was attached to it, to whatever issue they were working on, has lessened. And so that's the point. They're not going to forget, obviously, the event, but it's going to help them be less emotionally reactive to the situation or to the trigger. And like, I'm working with a guy right now who's had some pretty extensive trauma in combat and also childhood. And we started working on the stuff that he felt a little safer in, the combat stuff. And he's reported back that his triggers have totally decreased. He was having this reoccurring nightmare about the trauma, but it had his family spaces on it. And he says he does not have that nightmare anymore. It's gone. We've been working, it took only one session for that, but the stuff with the childhood, because it's a little bit more intense, we're doing it in segments. So it's taking a few more sessions. So you can't really tell your clients, oh, after one session, this is going to be gone. There's no guarantee. You just need to really fill it out with your client, how you feel it's safe to work. And so we've actually been dealing with the childhood trauma stuff. This is going to be like the third session. But what I do know is that he reports every time that he goes through it, that he is having a less of emotional reaction to when he thinks about, the specific trauma that he's working on. So I think that's about it. I see a question here. Is there a referral source for private practice providers?
Yeah, that's from Jake. I just want to make sure we understand the question. Can you clarify what you mean, Jake? Sorry, I put you on the spot.
No, that's it.
Okay, thank you. I really enjoyed this, so thanks for presenting. And for folks who are continuing after treatment, how would they figure out a good private practice provider of brain spotting?
You know what? One of the things, just like we do with EMDR or any type of specialty we have, usually the therapists will put on there that they are trained in brain spotting. Here in Northern California, we also have the Pacific Trauma Center where they do mostly brain spotting. I know they also have some EMDR specialists there. So if you're in Northern California, Folsom and Sacramento, that's one. But definitely I tell my clients when they get that list, like let's say Kaiser's their provider, when they get that list and they really want a brain spotter, to look at their the therapist bio and to see what it is that they say they specialize in, because this is such a specialty, they usually post it.
Good question, Jake. Thank you. Because I think, Jamie, as we look at this, we have them for a short amount of time. I know everybody, we all talk about 30 days, 45 days, seems like but it's not. So is this something, I'm assuming, and I'm just throwing it out there, when they're leaving and stepping down, this will probably be continued for a while, correct?
Yes, definitely. Especially depending on, like I said, you can't say how many brain spotting sessions somebody needs to work through something. It's really kind of interesting. Sometimes I have people that I think, oh my gosh, this is going to be really intense. And then they're like, after 45 minutes, they're like, no, actually, I feel really good. And, they've worked through it. But like with the guy I'm dealing with, working with right now, we're on our third session. So I definitely recommend with my guys, I tell them, if you want to continue this, it's really important that you look for a brain spotter to be able to kind of work through this. And we have our case manager here, and they help with the therapist to kind of show them the bios and where to look to see, okay, this person provides brain spotting. Unfortunately, it's still pretty new, so it's, I don't know. It's not, I've heard from Kaiser here, we're not really recommended, especially with our Kaiser clients. They say do not tell the client to look for a brain spotter when they leave here, and because there's nobody in Kaiser that does it. So what I tell the client is, let's see if we can find somebody who could work with you and maybe be a contractor from Kaiser. You know how they have their private practice in Magellan that they offer. And so we try to help them.
Thank you. And Daniel, I think I read your mind. Did I answer your question? Got it. Okay. And then Dr. Nevins, has a question about, I don't know if you can see that. Jamie, can you see her question?
Yeah, I do. So how do you handle it if a client has difficulty coming up with first words to focus on? Usually what I do is, and this is like my magic, I give them the bilateral music and they say, I don't know what I want to work on. I say, that's okay. Go ahead, let's put this music in your ears. And the bilateral music helps to stimulate kind of some emotions and kind of thoughts, and helps to stimulate that part of your brain, the subcortical part of your brain. And then it is not even like 20 seconds later, they're like, oh, this popped up, whatever it may be. And it could be a full-on moment that they want to, like a car accident or something, or it can just be, I think I need to work on my anxiety, or, I need to work on my mom, whatever, So usually they always come up with something. I haven't had a person not after I've given them that music.
Thank you, Jamie. Thank you, Dr. Nevins. One other question. I know we got about 5 minutes left. Can
I chime in real quick?
Sure.
So, having been a therapist for a while, more trained in talk therapy. And when I first came and was starting to kind of understand brain spotting, I'll tell you, I had a lot of skepticism about it. Because if you ever observe anyone who's having brain spotting, it's not a normal, what we would see as a therapeutic process where there's the dialogue that's happening. A lot of it is happening internally with the client. And the therapist is really just creating that therapeutic presence and not really directing the conversation or where they're going. And I will tell you that having seen the outcome, it is really amazing the changes that we can see in the clients with regards to their overall presentation. Clients who come in who are angry, depressed, anxious, and then over a period of time through brain spotting, you just see this natural relaxation that they get into physically. And so it really is, it's quite amazing being able to see it. I'm no longer a skeptic.
Another thing too that I think is just really important when we're talking about this topic is that as Jamie just sat here with you guys today and kind of did an overview of what brain spotting looks like, we also do that in a group therapy session with our clients. So we're not just throwing these clients into our office and doing brain spotting, but we're actually having some psychoeducation classes on educating them what brain spotting looks like, kind of letting them know what they're going to be experiencing and things like that. That way they're aware, of what's going to be happening. Another thing too that I think is my favorite part of this all is that, we could sit here all day and tell you how amazing brain spotting is. But I think the important piece is really the feedback that we get back from clients. There was a while back, and I'm sure this is still happening, but we had a couple people discharge out, which obviously means that we had some new members come into our facility. And as the clients are, welcoming each other, getting to know each other, one of the first or second things that the current clients are telling the new clients is, you have to do brain spotting. It will change your life. And as soon as Jamie and our therapist are going to introduce themselves to the clients are like, what is brain spotting? I want to do it. So I think that's really important, that the clients' feedback, that they love it. They see how much healing is taking place and how it's changing their lives is just really great feedback to be aware of. Because like I said, we could talk about how great it is all day long. But I know that the clients really do appreciate that.
Thank you, Angelina. I know we have 2 questions and we have 4 minutes. So Jamie, I'm going to put you on the spot. 4 minutes, 2 questions. Is this for everybody? One, I think, I'm kind of concising that. Is this for anybody, everybody? Who do you look for that could utilize this? And then I think the last part from Melissa is, how is it possible to use that via video?
Yes. I truly believe that everybody can benefit from this. One of the things that was said in our training is, it's like if you have an antibiotic and somebody is sick, would you give it to them? And that's the way I kind of feel that Brainspotting is it's an antibiotic. I've done this from just like people being in a car accident and having fear to childhood trauma. It's across the board. To even low self-esteem, all of that kind of stuff. It helps you to be able to kind of get more in touch with where those are coming from, the client. So I hope that helps with that. And if you have any more questions or you want to know a little bit more about that, you could totally ask me offline. And then I see you, Melissa, and you said how would you modify the procedure to accommodate video? Yes, actually, when you get trained in Brainspotting, there's a Facebook that we all belong to, and one of the trainings that she did was how to do this in this COVID virus and telehealth, and so she actually showed, and it is possible for sure. And I have a person I work with in private practice, my supervisor, she does it in telehealth, over telehealth. And she said it worked just fine.
Well, this is Jamie. Thank you so much. And thank you, everyone. I know we could go on for probably another 30, 45 minutes, and maybe we'll have a second episode of this down the road. But I want to thank you for your time, Jamie. Thank everybody for joining today. If you do have specific questions, my email's in the chat. You can send me an email. I'll make sure Jamie gets that and she can reply as well. I asked that, we have these lunch with AKUA every Wednesdays. Next Wednesday, we're doing EMDR. And so we would love for you to join that. The invite will be going out to everyone. And Kristen Torp, our clinician here in Orange County, will be leading that discussion. So I look forward to seeing everybody hopefully next Wednesday. And thank you again, and have a great day, everybody.
All right. Thank you, guys.
Thank you.
Bye-bye.
Thank you.
Thanks.